Hi, I'm Rod Hochman, the president and CEO of Providence Healthcare on the West Coast. We're in 7 states, from Alaska to Texas. And this is my first leadership meeting. And I have a great guest today for everyone. We'll be doing these once a month. Dr. Estes, who was my predecessor as the chair of the American Hospital Association, started us out, and I think you've all enjoyed these, and we promise to keep you no longer than 15 or 20 minutes to do this, because I know my attention span, and what we thought we'd be able to do is just give you some insights from some leaders in healthcare. This is the start of a new year. Last year was a year that's undescribable, and I don't think we can start any one of our meetings without thinking about the 400,000 Americans today that are no longer with us, and also the number of healthcare workers, now almost 1,500, that we've lost through this year, our nurses, doctors, and other health professionals fighting this pandemic. And I think it's a tribute that we all feel to the healthcare workers. And I know, as I introduce our guest, Tom Priselac, it's been an honor to work with them and be part of them. But those are the introductions. But without further ado, I'm going to introduce Tom Priselac, and I've known Tom for a long time. He's ageless, is the way I describe Tom, and he's been the heart and soul of Cedars-Sinai. And Cedars-Sinai is an institution for those of you who are on the West Coast, but throughout the country, and has really developed it into a major both academic and community center at the same time, which is no small feat. They serve almost 1 million people in the LA community, 4,500 physicians, and at any one given time, Tom's folks are working on about 1,500 research projects. In addition to that, Tom's a real spokesperson for quality access and how healthcare works, adjunct professor at UCLA at the Fielding School of Public Health, and really looks at organizational leadership and speaks on a variety of different topics. In addition to that, he's had my chairmanship a while ago as the chair of the American Hospital Association, chair of the American Association of Medical Colleges, the California Hospital Association, the Hospital Association of Southern California. And one would ask is, how does he do this, right? He is able to do all this, but gives a lot back to the community. Today, we're lucky for our leadership rounds to get Tom's on-the-ground perspective as to where we are in COVID-19, the pandemic, and particularly being right at the apex in Southern California. So, Tom, welcome, and glad that you could be with us today.
Thanks, Rod. Thanks for the kind introduction.
So let's start out, Tom. We're all hearing about Southern California. You're on the local news every night. What I think we'd all like to hear is, what's it like on the front lines in California, and are you seeing any light at the end of the tunnel?
Right. Yeah, no, great question. And, you mentioned that, it's a new year, but in some regards, the experience in Southern California just transcended the years. The January 1 was like December 31st. And at that particular time, frankly, it was very challenging here, and it remains challenging. So the peak picked up around the middle of November, started to pick up, and it has carried through. The good news is, in the last week, things have kind of stabilized. And in fact, the infection rate in Los Angeles has finally started to drop. So there's hope here that things are settling down somewhat, but obviously a long way to go.
Tom, we've heard a lot about the variant COVID, particularly in Southern California. Do you think that in any way is influencing what we're seeing in terms of cases? Any insights you have into that? And I know your people are probably studying this as we speak.
Yeah, actually, it was our researchers who first reported in the literature their analysis that identified what is now called the California variant. And we do believe that it is one of the explanations for the rather explosive growth that occurred. Really starting, it could not. We all recognized it all. It didn't seem to totally correlate with the holiday travel question, which was on everyone's mind. And so this research that we've done suggests there is a variant that we believe is at the heart of it. And the follow-on work to answer that more definitively is going on as we speak.
Yeah, Tom, January 20th marked a couple of different things besides having a new administration. It also is the one-year anniversary of the first case that was recognized in the United States, and here we are a year later. One of the things I know that's on all of our mind as healthcare leaders is that COVID-19 fatigue, but more importantly, how are your people doing, and can you give us any insights into how you're keeping their spirits up with probably another good 6-8 months to go as we go forward?
Yeah, that's a great question, and I'm sure for all of us, the issue of the fatigue of our staff members who have just been incredible. I mean, let's take a moment and just acknowledge the miracles that are being done by our staff every day across the country. And so recognizing that, I guess, first of all, from day one, our communication with our staff from day one was fairly straightforward. Number one, we're all in this together. And number two, we will use all the resources at our disposal to support you and give you what you need. And so throughout this effort, whether it's the PPE issue, but far beyond that, matters of our pay protection program to make sure that staff who wanted to work, even though their regular job may be impacted, staff who wanted to work in other ways, they knew they could have a dependable source of income. You know, pretty basic kind of question. But beyond that, the kind of things that address people's concerns early on when not much was known about the vaccine, people were worried about going home, providing hotel support and things of that nature. More recently, with regard to the fatigue question, throughout the pandemic, we've had in place a program with a third-party company that provides 24/7 counseling services for our employees and their family members. And actually, in this most recent surge, the intensity, frankly, became so great that we brought those folks on site, and they're working here on site at the main medical center and our other hospital.
You know, Tom, I've been so impressed by the number of folks in all our health systems that have been accessing these services and how helpful they've been. And do you think it's making a difference? And where are you seeing the greatest stress? Is it amongst the nurses? Is it the doctors? And how are you finding enough staff to deal with what we're seeing every day in the ICUs and in the emergency departments?
Right. You know, I think there's a gradient that really runs along the intensity question. So there's no doubt that the ICU staff and the intensivist physicians, I think, have been under the greatest stress, especially while the death rate in this most recent surge is not higher, the numbers are much greater. And there's been a particular issue in how supporting the staff around the number of people dying compared to what they are typically used to. So it's affected staff across the institution, the respiratory therapists and others who are working in the ICUs. And that's why these kind of support systems we have found have been very helpful. And frankly, it's the direct feedback we're getting from our staff and our physicians that is telling us that this is an important part of our response for them.
The third element of this, it's what's the status on the ground and how are our people doing? And then the third thing that's obviously on your mind, on my mind, and a lot of our listeners is vaccination. And love to get your perspective of how that's going in one of the busiest and largest counties in the United States and one of the largest states, and getting your thoughts on what's working and what's not working.
Right. Well, I would start by saying that all of us, we're at the end of the supply chain in this regard, aren't we? And we're on the receiving end of both those aspects about the vaccine program that are working and those that aren't. As you know, each state has develops their own rules in this regard. And here in California, there's also a delegation to the individual counties. And so the main challenge, frankly, has been the supply shortage, which exists in California, as well as Los Angeles within California. And so the primary and Los Angeles, or California and Los Angeles, both set up basically a rule set following the federal suggestions to do healthcare workers first. And literally, we're really in the later stages just now of completing the healthcare worker, both here at Cedars-Sinai, but we also extended our ability and are offering healthcare workers more broadly, because moving to over 65 in Los Angeles County had been directly tied to completing healthcare workers, which was increasingly problematic given the supply chain. So we expanded our services to help other healthcare workers get vaccinated. LA County just this week announced that it's being expanded now, starting today actually, to those over 65. Within the limited supply that we have, and compared to demand, it's very limited. We have started to now feather in those over 65, reaching out to our more vulnerable patients to begin that. And we actually have ready to go a site in the shopping mall adjacent to the medical center, ironically. We have a site where we'll be able to do 3,000 people a day through a drive-through. But again, as of today, we don't have the vaccine. And so we're ready to go. We need the supply.
So the question comes up, Tom, once, I think we have hope that with the J&J vaccine, that's a single dose that doesn't require the freezing and thawing, that we're going through. Once we have a vaccine surplus, do you think you have the right delivery chassis to get everyone vaccinated? It seems, I talk to people from all around the country. It's very spotty all over. I don't think California is an exception. And it depends on having the right software to register people, to get people to deliver it. So what does your crystal ball tell you about where we'll be next? Once this vaccine shortage kind of isn't there, can we deliver?
I think at least here in LA County, I think it will continue to be a private-public partnership. I think the county will continue to operate what they refer to as mega sites for some large-scale activity. But I think that's going to be accompanied by, and I certainly hope that will be accompanied by, continuing to make use of the health systems in Los Angeles, your own, the segments of your own and others here in this part of the state. And build it out in that way. We're currently developing how that's going to happen in our physician network, for example, to make the access question hopefully that much easier.
What I worry a little bit about, Tom, I know you're thinking about it too, particularly in places like LA County, are we going to get to those locked away seniors and some of the poor and vulnerable folks in the community who aren't savvy enough, maybe don't have a car, don't have the ability to get there? Any thoughts on, because you have this suspicion or this feeling that some people are going to be left on the side. Right.
For me, I think this is where all of our community benefit missions really come into play. And what we have done to date has been very actively involved and integrating our efforts with our community benefit activity. So that first of all, that started by listening to our community benefit partners to help us answer that question. Who are these folks? Where are they? How can we reach them? Many of those community benefit partners will be the people who can tell us where they are, who can help us make those connections, and we will be leveraging our existing partnerships in order to do that. We and other healthcare systems actually set up a coalition just this past year, recognizing this problem just as it relates to traditional flu. Yeah. And we created, along with all the healthcare systems here, together with the LA County Department of Health, created the LA Coalition. And that group is being activated now to hopefully address the kind of question you're raising with regard to the COVID vaccine.
Great, Tom. With the last question, I'll save the toughest for the last. And again, kind of looking towards the future, I think we're all trying to speculate in this world before COVID, during COVID, and hopefully after COVID. What does the after COVID look? How does healthcare look differently in the after COVID period? Right.
Look, there's no question that I think the whole COVID question has required us all to think about many things, not the least of which is the ability to use telemedicine and things of that nature. And so we're focused on really trying to look as broadly and deeply around how we leverage the telehealth and telemedicine kind of capability in every aspect around that. We think it's going to be a great adjunct to our efforts to do better in the mental health and psychological support area. The whole remote monitoring question, I think, creates terrific new ways of doing even better in chronic disease management. But it's also on the urgent care side, by the way, I think all of us have seen urgent care drop off dramatically during this question. And so that raises a whole nother question, and that is, maybe it's not so much as many urgent care centers as we had in the past, but maybe there are more diagnostic centers that can be matched up with the video and deal with those aspects of it. And then finally, our physicians and other clinicians, I think, are asking themselves the question, well, just how much medicine should we be providing? And that, of course, gets to the whole question of the payment system and things of that nature. But there's a serious question about, let's examine what's the frequency for people to be coming back, and what's the right amount of care to be providing. So I think it's really cut across the care delivery question in multiple ways.
Yeah, I think, we're going to see, both from a scientific standpoint, your researchers and Cedars, and then on the healthcare delivery side, I think we're going to see big changes as we go forward. And the good news is that some of those are for the better as we move forward.
Right.
But Tom, again, thank you. Thanks so much for this conversation. We could go on forever together. Right. And it's so great to get your perspective. And I think people around the country are anxious to hear about what you're thinking, and particularly what's happening in California. So with that, I want to thank all of our listeners for spending a few minutes with us. And hopefully we've answered some questions and probably created some questions for you. But thank you so much. And thank you, Tom, for being with us.
My pleasure. Thank you.